Temples. The injection in the anterior part of the temple extends between the superolateral orbital edge and the hairline, and then the temporal crest of the zygomatic arch. The crest represents the upper edge of the origin of the temporal muscle. This crest is not very visible in young people. Fat loss and skeletonization create concavity, revealing signs of aging, sometimes to the point of creating an unpleasant-looking ridge at the lateral limit of the forehead. The main anatomical precautions for the injection are the auriculotemporal nerve, which is a deep sensory branch of the mandibular nerve, which goes into the infratemporal fossa and whose main branch extends posteriorly to the injection zone. The frontal branch of the facial nerve, which crosses the fold to be injected. It is located in the superficial temporal membrane. Superficial injections can deposit the filler in very close proximity to this neural branch. Deep injections in the temporal muscle are not made close to the frontal branch. It is very rare that a neural branch is damaged by a fine needle or cannula. The anterior branches of the artery and superficial temporal vein, which pass in front of the tragus and become subcutaneous at the level of the zygomatic arch. The so-called sentinel vein, a branch of the superficial temporal vein associated with the frontal branch of the facial nerve at the supero-external edge of the eyebrow. Medial and deep temporal arteries and veins in the temporal muscle. After disinfecting, make a pre-hole with a needle to the zygomatic arch until the dermic-hypodermic junction and insert the cannula parallel to the cutaneous plane in the desired injection plane. Sometimes fibrosis can be felt at the temporal crest. If this creates a groove laterally to the crest when the temporal fold has been corrected by injection, it could be useful to use a bolus in this depression. Therefore, it is advised to use precaution to fix this. A few small boluses by needle followed by a massage. Create a fan covering the entire area to be injected, which can then extend beyond the tail of the eyebrow. Note that skin is very thin in this area and the cannula should be inserted very slowly. Do not deposit radiesse beyond the orbital edge. Sometimes it is necessary to complete the treatment with a bolus in the temporal fossa by very slowly inserting a needle perpendicularly to the bone and injecting a bolus in the supraperiosteum. Cannula injections through the deep temporal membrane and temporal muscle can be painful. Go until hitting the bone. A small aspiration can be made to ensure that it is not in a deep temporal branch. Massage and shape the zone injected to evenly spread the product. A few irregularities may be visible immediately after the injection, but these will disappear fairly quickly. It is recommended that this area be massaged from top to bottom along the muscle fibers. With Radiesse, the result can be assessed immediately after the injection and may vary from patient to patient. Results. The results obtained using the Radiesse injection are as follows when correcting the temples.